welcome to the My Status Quo podcast. I'm Michelle High.
And I'm co-host Donna Felter.
And tonight we are bringing back with us Nurse Melissa Bergamo.
Hello.
And we are going to talk about something all of us have to do, many of us don't do, the end of life wishes, deciding DNR or full code.
Yes.
And so there's so many things that wrap around this that, yeah, it's a big conversation, and really glad that Melissa's going to bring her 30 plus years of experience here as a nurse, as a hospice nurse, and working in all aspects of healthcare at this point to share what she has seen, because I know that those of us who work in the field have very different wants and understandings of these. So we're going to cover that too, how somebody who doesn't work in this reacts. And it's a big conversation, but yeah, welcome.
Thank you. I'm glad to be here.
Yeah. How would you like to start this?
So, because, it's like the elephant in the room is the DMOST, Delaware Medical Order for the Scope of Treatment. But when doctors, social workers, and other professionals present this idea, they say, do you want to be a DNR or a full code? And they don't give them the options that are listed on the DMOST.
Okay. So what's the difference between DNR in simplest forms, DNR and full code?
So in simplest forms, DNR means do not resuscitate, do nothing. If somebody dies, let them die of a natural death. Full code is you're going to go all out and do whatever's necessary, including shocking them, intubating them, whatever is needed, compressions, which sometimes crack ribs, which we were just talking about. CPR can be very brutal. And trying to bring a loved one back, especially if they're frail and have several chronic diseases or dementia or something like that, is very traumatic to the loved ones, but they don't realize what they're saying sometimes.
Yeah. So one of the things I think we're seeing a lot is that someone in the family has their wishes set. They have either chosen a DNR or a full code. They have filled out their DMOST form. They've gone over it with someone, but their family might know their wishes too, but not really how to advocate for them. And I think what we're seeing recently is more people that have a DNR, and then the kids have already made the phone call. Mom has fallen. Yeah. Mom has stopped breathing. And I understand being at home and maybe your caregiver isn't there at the moment. And all of a sudden the son or daughter's in the situation. And yeah, of course, calling 911.
So
go ahead. Yeah.
Yeah. I've actually been on this end of things in my life, with my father, and watching him be intubated, and actually watching him be intubated multiple times. And there comes a point when somebody is frail. My dad, I wanted him to have fluids if needed, but I didn't want them to force feed him, and I didn't want them to shock him because he was dying and he was frail and fragile, and it felt cruel to tell them to do those things. So the DMOST is actually a wonderful piece of paper, because you can actually put whether or not you want oxygen, whether or not you want IV fluids, whether or not you want feeding tubes, and then say, no, I don't want to be intubated, or no, I don't want the you pounding on my chest and cracking my rib. It defines different, what do you want? What is reasonable for that person in their disease process.
Melissa, I'm sorry, I didn't mean to interrupt. The DMOST form is a legal binding document, correct?
It is, but it's a piece of paper. So like anything else, it can be ripped up. So my recommendation to patients is to designate somebody that they trust, somebody that knows what they want. And when that DNR is filled out, put it on the refrigerator. Because if you call 911, let's say we call 911 right now and I'm a DMOST, but you panic and go, oh my God, no, do that. If someone else were to walk in the room and go, is that a DMOST? They will literally stop what they're doing. They will stop. They will look at it. They will see what's on there because it's a legal document, as you said.
So they are required to look at that document
If
because
they
there
know it's
are
there.
options.
The problem is if they don't know it's there.
And there should be the location, from what I understand, should be either on the side of the refrigerator or I guess in the room the patient's in.
Yes.
Would that be correct?
Ideally,
Okay.
So when
File of life is what we're
Yeah.
talking about fully, right?
fully, when EMTs go in,
Mm-hmm.
they look on the fridge because that's where most people will put the DMOS. So yeah, that
Okay.
is the best way to do it, because reminding somebody who may be panicking that no, grandma doesn't want to be resuscitated and we're not going to do that to her.
So if you're finding that the emergency or the EMTs are not looking at that form, you
They
should
don't know
then,
it's there unless
oh,
someone.
it's not automatic for them to look for it?
Oh yeah, we're not saying they're not looking for it. We're just, because I think
Yeah.
that's the typical place. If you're aging in place, you're a senior, you need some kind of care. You've got that file of life that's on the refrigerator. That's
Yep.
where it
Okay.
goes in every
Okay.
home. That's where they go to look for it because
Yeah.
they're going to go to the kitchen. It's the most
Yeah.
easiest,
And that
place
is
to
kind
find
of like a
standard
thing that is standard across the board. Hospices tell people, nurses tell, it's a standard.
Okay.
I think what is added to it is even though it's there, and in 1991, working in a facility, if somebody stopped breathing on night shift, we pushed the button, called the nurse. They had to pull the file.
Yeah.
These are people who are fragile,
Yeah.
even though it was assisted living, and they have their wishes. And
Yeah.
I remember that. And remember when I was young thinking, oh my gosh, that's a lot of time. But
they have to.
So that is how legally binding it is. But when Melissa said it can be torn up, what happens in many situations is the 911 is
POA.
called, the power of attorney or medical power of attorney calls 911 because they see their loved one in a state they're not comfortable with.
Mhm.
Maybe that loved one's in hospice,
Mhm.
to which they would just be calling the hospice nurse because that's when the decision gets made in that level of care. But let's say you're in palliative care or before that, and you're a DNR, and your son or daughter sees that you have fallen on the floor, and maybe he found you that way. You're
struggling to breathe. They're going to
struggling
call
to-
911.
They
Panic.
will panic, and
Of
they
course.
will start talking to the EMTs and
Mhm.
tell them what they want.
Right.
And that is
Correct.
often what happens.
Correct.
And I'm not reflecting badly on EMTs.
No.
Love all their
It's
amazing workers in our world.
it more
It's the families
goes
problem.
around to
Right.
the
It's
family
almost like
who
they're trying
can't
to
accept
they're trying
what's
to skirt
actually
the
happening,
issue.
which
Yeah.
is a whole nother, accepting that your loved one is dying is a process. Everybody's different.
Yeah, that's very true.
I think we could take people through the DMOST form because, you are feeling like you're filling out something
It is.
that is so final, and that's not really the case. There are a lot of options on this.
There are. And, it starts off with CPR, do not do CPR, but then it goes down into different things, full treatment, limited treatment, which would be like oxygen or a CPAP versus being intubated. Comfort measures, using medication to treat pain, artificial fluids and nutrition. Do you want them to have a tube? Do you want them to have IV fluids? Depending on where they're at in the dying process, sometimes a bad thing, and then it breaks it all down to what do you want to happen? It's not just a yes or no.
Okay. So like, let's say I'm filling out this form and I'm a DNR. I do not want to be, if I'm over, can I put on there when I'm over the age of 70, if I fall to the floor, am not breathing, I do not want to be resuscitated.
So yes.
Okay. So just with that example, how would I
you
fill
can
it
put
out?
that into the treatment of symptoms and comfort measures
So in
area.
part C, treatment of symptoms only.
Mm-hmm.
Okay. I could put my age.
Well, you can put, I don't want to be intubated and I want to be on mechanical ventilation for 2 weeks. If you can't get me off, then, you can say it how you want to say it in that section.
Okay.
I don't know that the age thing comes into play.
All right. Well,
so that is, that's a part I didn't think about. Yeah.
Well, no, I'm young, I guess.
Yeah.
Right.
Me too.
Yeah, no,
but,
yeah.
But I people have been having a lot of different reactions, different things. People are dropping at young ages.
Yes.
And I think they're.
Yeah, no, I've made it very clear to my spouse that I don't want to be a vegetable. And she's made it very clear to me she does. So, and she doesn't understand what she's really, I truly believe she doesn't understand what a vegetable is. But
yes, I mean,
she thinks she's going to sit on there and just, it's not going to be bad. And
she doesn't like vegetables either.
Yeah, exactly.
We love you.
But she,
she wants everything done.
She wants everything done. So I respect that.
If she was filling this out, what would it look like from her perspective?
From her perspective, attempt CPR, full treatment.
So part B, check, attempt CPR. Yeah.
And then part C, full medical treatment.
Okay.
D, long-term artificial nutrition, meaning a PEG tube with tube feedings.
Okay. So she would probably pick that.
She might.
Yeah.
She might.
Yeah. So talk about part E there. Orders discussed.
So whether or not there's a power of attorney, guardian, an official guardian of the state, you have to check off. We talk to the patient, we talk to the guardian, we talk to this, we talk to that. The patient has to sign. And then if there's somebody that's a representative, they have to sign it as well.
Okay. Yeah.
And then the last section is just, a physician saying, yes, this is appropriate. Meaning, if a 13-year-old fills this out and says, no, don't resuscitate me, a physician's going to look at you and go, no. If a 90-year-old without any disease process, you know what I mean?
Okay.
Right. So, but 80 years old, 90 years old with different medical issues, the physician's going to just go ahead and fill this out for them.
What age do you recommend someone fill this out?
That's a tricky question. I think it's more wellness related. So if you are, because I've considered filling this out myself, if you are diabetic, if you have multiple things going on and you don't want to be intubated and you don't want to be left on a feeding tube, absolutely not. I would go ahead and, if things are starting to, as we age.
So change it with conditions.
Yeah.
So.
And it can be updated and changed.
Yes.
Yes.
Yeah.
Like I said, it's a piece of paper.
Mm-hmm.
So.
And you can, even in the hospital, you can null and void it.
Yep.
Just because you can speak for yourself
yep.
at any moment, you can say, "Don't listen to that. I want to do whatever you get." Right? Like there could be those things. So.
And people think that, and I always say that to my patients, you're not signing something in stone. You're signing a piece of paper for a suggestion at a certain point.
Okay.
So it doesn't need to be, a lot of times I would get hospice patients that were still driving, going out, and they would look at this piece of paper and go, absolutely not. So you'd have to explain it that, it can be updated. It can be changed. Did you really want me to put a feeding tube in you? Yeah.
Right. Okay. we talk about a lot of work related situations,
Mm,
and
I got a good one.
Okay, yeah, go ahead, because I think what we're ready for is to give people some actual life situations that they should think through and why this is so important.
So, an actual life situation. One of my last days working at a nursing facility, a patient who had long-term heart disease, CHF, was older. They're in assisted living. He's living with his wife with dementia. Did not have the DNR on the fridge. And everybody's scrambling, trying to look in the system, going, where's the DNR? Where's the DNR? And I flat out, like, I am, in that position, it's my liability that I have to go ahead and start CPR and call
If
911.
they can't find it?
So
Oh
I
my
started
gosh.
CPR on somebody that was blue, and I mean blue.
Oh, God. Oh.
And frozen rigor mortis had set in. And it was terrible because this poor wife with dementia was just crying. But
Aw.
I'm obligated to do that. So it's people just don't, you got to think about what, no one wants to think about dying, but think about if something should happen, what do you want that to look like?
Right.
Yeah.
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 Oh my gosh, just working in it as long as I have, I must want my kids or whoever is there for me. Like, you need to know what I want. So that's something we're finding is people might have a DNR. No, I do not want to be resuscitated.
Yeah.
I do not want treatment. But the kids are
Are
advocating,
oblivious. Yeah.
are saying, oh my gosh, no, do whatever you can. And that happens.
It happens.
Yes, yeah, it does happen. But I think you really need to be very clear about when you want your wishes to be applied
There's a lot
to the
of, and
condition
it's
you're
a
in.
cultural thing too.
Yes.
I have a friend, if you talk about death, then something's going to happen to you.
Oh boy.
So they don't even want to talk about it. So bringing this kind of thing up when someone starts to decline, it's a touchy subject. Nobody wants to talk about death. Nobody wants to talk about the what if. But none of us get out of here alive.
Right.
And my understanding is that, more than 50% of people over 70 have this, but it's not too much higher than that. And I think people just need to say anything can happen at any time.
Yeah.
And be prepared.
Yep.
Yeah.
It's just like preparing for, some sort of tornado or something else. You're preparing for something for the just in case so that it doesn't end up being a terrible situation of somebody intubated on feeding tubes and then you have to make a choice to take them off of that. And that is way more traumatic.
Oh, yeah.
Than having this filled out.
Having had a lot of conversations and talking to families when they feel like they're playing God. And what I usually say is, well, it's us who's actually keeping them alive right now. So I wouldn't look at it that way. You're just stopping man-made treatment.
The inevitable.
And letting them pass peacefully. And also my understanding, which we talked about before in a different podcast, was the natural death process is actually not as bad as one might expect.
It's actually better if you don't do the IV fluids or push fluids.
Why is that?
Because people get what is called typically is the death rattle. What happens is the body is shutting down and families want to push fluids because, oh my God, we have to do this so they'll stay alive. Otherwise they think they're withholding it from them. And what happens is that fluid, it goes everywhere else, including lungs. So it goes to the arms, it goes to the legs, it goes to because the body is shutting down. It doesn't want or require.
Okay. And what does that have to do with edema too? Is that
Depending, edema can be cardiac, but yes, towards end of life, people's arms will swell and things. There'll be a lot of swelling.
Because
Because
hydration's just not going to the same
so
place.
being dehydrated, as terrible as that may seem in the dying process, is actually more comforting for the patient.
Yeah, it is hard.
I know. It's terrible. It's not an easy conversation for people. It really.
No. And so many adult children that are there with their parents just saying, well, don't starve her or him.
Yes.
And
Yes.
all you can do is say, this is what happens. And we need to listen to her or him on whether she wants food or not. And
yeah. So that part is a hard discussion. But going back to the DMOST, you can put that on there, and you can tell the person that you're leaving in charge, basically, of what happens, that this is what you want, and that's it. So when the question comes around and something happens and you're in the hospital and you're in a panic, you can hand them the DMOST and not have to make a decision because it's already been made.
Carry it in your purse, in your wallet, maybe.
I had a lady take a picture of it on her phone and her iPad.
Oh, yeah.
Oh, yeah.
That's smart.
Yeah.
And you can.
Because she absolutely did not want to be.
And you can update it. What, you still have to have your doctor sign it, or can you
Yeah,
update
it has to be signed. Once it
it
is signed, it doesn't have to be updated, but you can.
Okay.
Did you have to have it re-signed again? Did they have to?
You would
Does
have
the
to do
doctor have to sign with every revision?
Yeah, every revision would be a new document with
Okay.
Yeah.
Okay.
Yeah. I think I feel the most for the person who's actually dying.
Yeah.
Having seen it. And I want to just bring this to people's attention who don't work in the medical field, that when you've seen it 100 or so times and you want that person to pass because the pain will be gone and they will be at peace.
Yeah.
And you are dealing with family who, and I get it, as before my time in the medical field, I was that family member, and I would do anything, and you just don't understand the whole process until you're living it, and
the implications.
Yeah, the learning curve that happens for the two parents you have in your life is just so huge. So, trying to help people understand, please talk to your parents.
Yes.
Someone might not want to talk about it, but you could bring up this podcast and say, you need to listen to what could happen.
Yes.
We don't want to be in a situation of not being there for a loved one, as hard as that decision might be. And then when you deal with cognition issues, dealing with someone who, oh my gosh, Donna, I'm going to touch on Phil and probably cry. So, just as far as he fought for so long and so hard, and you both so valiantly and honored each other till the very last moment. I think that had a part to do with his care at the end. I don't think he was thinking quite clearly.
Yeah.
I remember you saying something about that, and we don't have to talk about it.
No, the side effects of illnesses take control, right?
Mm-hmm.
And 1 minute you are able to do certain things, whether it's communicate a little bit, understand better when you're having a conversation, and then months later, things can take a drastic turn. And I also find that when you are the caregiver, sometimes depending on the amount of care you have to give someone, and in this case, he was 24/7. He was on a feeding tube, he couldn't swallow, so communication was very difficult. We're using a letter board to communicate when he was able to even do that. But then weakness took over, and then he was too weak to really use the letter board. And when I tried using a keyboard for a computer that was separate, then I really noticed the difference because he was stumbling basically over those letters, trying to figure out how to do it. So you do start to see those changes, and it is difficult to watch and to experience. But with that being said, sometimes when you're a 24/7 caregiver, you don't often see necessarily what other people from the outside may see
Exactly.
instantly.
Exactly.
And somebody like a relative or neighbor may come walking in the house and just to visit with Phil and may be in shock because they see a huge difference from what he was like 2 or 3 weeks earlier, maybe a month earlier.
Mhm.
And whereas I'm so busy taking care of him, I just think he's still, everything's still okay. And of course, everything wasn't because he was declining. And at some point, certain things occur, like that keyboard incident.
Right.
It's like you're being slapped in the face. It's like, wake up, caregiver.
Mhm.
See the
And
changes. You know,
like I said, I dealt with it with my dad, and my cousin kind of slapped me in the face and said, what are the last words you want for him to hear? And that was a reality check of where we were at.
yeah, it's no matter, you
So,
know, it's very difficult to deal with. And in Phil's situation, we were not expecting this outcome because he was supposed to recover from his treatment, and it did not go that way. For other people who know that their time is coming to an end, within a few months or 6 months, whatever, I think you can prepare for it a little differently, um,
sure.
mentally, physically.
Yeah,
But when you're
it's
not
a process.
thinking that's supposed to happen, it's a different mindset that you also have,
Well, we
because
also
you're
have the responsibility of the physician. I'm going to throw this out there.
Oh yeah,
okay.
we can talk about that.
Because the responsibility of the
Oh,
physician is
God.
to tell you what's going on.
Right.
And the last conversation I had with a physician before my father died was, well, don't you have to intubate him again? And he finally said to me, if we intubate him again after the sixth time, I don't even know, we're going to damage his trachea. Do you want him to
Mm,
have, you know, yeah. And I was like, absolutely not. So it's, but that was my smack in the face because I had to I had to push it
right.
for him to say, this isn't a good idea. This is not where your dad's at. Your dad's dying. And it's like, well, then, and my brain shifted. Well, why are we giving him antibiotics if he's dying? Why
Yeah.
are we?
Right. Right.
Why are the doctors so hesitant to say, look, I mean, they could just start out with, look, I've been doing this 5 years. Here's what
Right.
I think is going to happen.
It goes back to the DMOST. It goes back to that paper because it's what do you want to see happen?
Mm-hmm.
This is where we're at. What do you want? That's why that paper, and I am very serious. I'm 55 years old, but I'm considering filling one out.
Yeah, we can do it right after the show.
Because
Yeah.
I know Little Panic, and she knows me. I don't want to be a vegetable. I don't want to be intubated.
So I have a friend who's talking to me. She is 76, and she said, my kids are not going to let me die. Flat out. Because we have these conversations, because these are the conversations I have. I have these conversations with people. I don't know why God has put me in this spot, but he has. And I'm thankful. But she said, seriously, Michelle, I want you to be there to be able to say to my kids, hold on.
Here's a DMOST.
This is her
legal document.
DMOST.
Yes.
This is her, she's a DNR.
Yeah.
She stopped seeing doctors because over the age of 75 in Delaware, you're literally allowed to not go to the doctor. You don't have to go to the doctor anymore. It's interesting to be in that position because I don't have any legal thing, but I've been able to show up for families and make things happen. And I'm a nobody like dementia caregiver. Well,
No, an advocate is important.
An advocate is important. You can show up. I can show up for her. I'll meet her kids, and they have my number, right? And it'll be call Michelle, because I am that person who needs to show up and say, look, and I love her too.
Yeah. And I know this is hard. However,
do
you want this to happen?
Right. Here's what you're looking at. And that is not what she would have wanted.
Yeah.
So so in your situation, being married to someone who wants to keep herself alive and yourself alive, probably.
I've told her, so I've told her under no circumstances do I want to be a head on a pillow.
Right. Yeah.
So, we've talked about it enough where I hope she honors it.
Yeah.
But that's why I'm considering filling this out.
Oh, yeah. Yeah, filling it out.
And having that extra person be like, no, she doesn't want that. As you get older, I mean, it's the reality.
Mm-hmm.
Yeah, it is.
It's sad. It's hard. It's sucks.
And within older couples, one of them might not want to talk about it.
Yeah.
And I really feel for that couple, because then they're making decisions in crisis mode.
And if it wasn't for what I do for a living, that's what would be happening between us.
Yes. I mean, that is what happened to Phil and I, because he did not want to talk about it earlier in life. And it wasn't until we got towards the end that, those decisions needed to be made. And as a matter of fact, it was a hospice nurse that mentioned to me that Phil had less than 3 months to live. And I will tell you, that was the best information I could have been given. I mean, obviously for preparation.
Yeah.
And of course, it's not what I wanted to hear, but in regard to preparation for the end is coming, to have that guideline, to know that, I don't know what she was seeing that obviously I couldn't see, but it helped me to prepare, and to face it and to focus for what was changing, what was coming.
Yes.
So.
Yeah, I wonder. I mean, if there are any doctors listening, please reach out and let us know. I understand delivering the bad news is not maybe what you wanted to do in your profession. However, I mean, what is the harm? I don't know. What is
could it be a lawsuit? I mean, do people sue because I mean that was always the thing, right? Doctors are limited in what they say. I don't really think
that's it as much as until you say stop, they're just going to keep going.
Oh, their job is
to try to heal you.
Okay. Right.
So, many physicians that aren't comfortable with it. When Lynn's aunt was sick, and I remember sitting there, and within 2 visits, I said, oh my God, she needs hospice. And we called her cardiologist. He said, no, she doesn't. And then we called him back and he goes, fine, she can go on hospice because she's going to die. And it was like this terrible response because he didn't want to deal with that.
Oh my goodness.
Yeah. So it's a cultural, it really is.
Yeah.
It goes back to talking about death.
Mm-hmm.
Interesting.
What I will say, and Lynn had a very bad experience within the past month, and had a pretty close call.
Oh, what happened?
And the thing she said to me is she couldn't see, and she could hear, and she couldn't talk, but she could hear what was going on. And she remembers certain statements, which kind of,
like things that EMTs were saying?
Yes.
Oh, gosh.
So she remembers one of the EMTs saying her blood pressure isn't compatible with life. She came back to me with that statement.
Oh, my God.
Which is a medical statement. So, but EMTs are, and
they're talking amongst themselves. I mean, they got to do it.
Because I walked, saw me, I was like, do what you got to do.
Yeah, I was here for that. It was a really hard night. And,
oh, that's terrible.
Yeah, she her blood pressure was super
So
low. I've never
low.
heard of it that low.
Yeah.
Can we talk about how low it was?
30 over 17.
30 over 17.
30 over
She was dying.
17?
She was dying.
Lynn, you're
She
a
went
mutant.
something.
You're a beautiful mutant.
She is. She is. And she had,
Oh my God.
you know something's wrong when, two EMTs show up, then another 2 EMT, and then another 2 EMT.
Right.
Wait a minute.
And the whole crew's there.
Working on her?
6 people.
Oh my God.
So, I am very lucky. She is very lucky.
She's lucky it was pre-season here in Beach Town. The EMTs had nowhere to be.
Oh God.
Oh my God.
Yeah.
Well, I'm glad she's feeling better. I'm
Yeah,
assuming.
she's coming around.
Good.
But she's sad.
So yeah, your conversations are really different.
Yeah.
Because she might not.
I think that we're gonna get closer to let's talk about this. Do you really want me to have you intubated? Do you really want that? Like after going through that, So
yeah, I am glad that she was given every means possible to keep her going. I know there's a change in lifestyle for her, but she's got a lot of days ahead of her with that change.
Right.
And that is what we all want.
Yes.
I mean,
yes.
one. You need to have quality of life, and that doesn't mean being kept in bed and changed and fed.
And turned every 2 hours. Yeah. Please do not.
If you're lucky.
Maybe
at home with home care. And I think facilities, again, no, age in place, but the healthcare industry is struggling. Staff is short.
Yes.
And just stay.
Companies don't want to pay. It's nurses after COVID ran away.
Yeah, they did.
Understandably, a lot of nurses went, the hell with this.
Well, they all have PTSD.
Yeah.
Yes. I can't.
Oh, yes.
God bless them.
Yes.
Well, ladies, I think we've done a really good job going through DNR and full code, giving some examples, personal experience also. And, is there anything else we want to?
Yeah, I don't think so. I mean, we touched base a little bit on the family dynamics, on the decision making.
Mm-hmm.
Should they lean towards the doctor to try and make that final decision? So, as I think Michelle mentioned earlier, you have one family member wanting one thing done, let's do the DNR, and the other one's like, oh no, let's go full code.
Oh yeah.
So is it best for them to consult the doctor at that point to try
absolutely.
and
but the doctor needs to be honest.
I think so.
The doctor who signed it, and if I say, please don't do this to me, can go and repeat that back to the family members. Look, this is what she said. So, even if Lynn says intubator or paddler or do whatever you got to do.
Right. Get that family member up and walking.
Put her up in a chair. No, I don't want that.
I think, go ahead, Michelle.
Just, we're talking about people who have such limited energy and ability.
Yes.
Like they shouldn't have to be fighting this point. It's kind of where my heart is going for this.
Yeah.
A good death after a good life. Now that I know it's possible.
Yes.
That's what I want. I think it's what most people want. I just think so much of our society and just the culture,
the
of
fear
not talking
of death
about it, which we should all be wanting to go to heaven. We know Earth, it's not going to get better. It's not going to ever be perfect here.
This is hell. I'm sure of it.
This is hell. Yeah.
Right.
You should be wanting to get to heaven if you're a Christian.
Wherever you're supposed to go. Yeah.
But now seeing so much and so many people that are in a transitional stage, we honor birth.
Yes.
We hire doulas, to have the birth experience that we
Yes.
want to have in a pool with some doves and all that.
And a dolphin.
And a dolphin. You know, let's start looking at death that way. You know,
Yeah.
like I want to have a death
Like how I leave this
experience.
world, I want
Yes.
people that I love.
You know,
around me.
that's a very interesting point, Michelle, that you just made, because
Yeah.
when someone is near the end of life, you know, it's interesting to think that way, because, well, maybe we should, I don't know. Do you want to bring in flowers? Do you want to celebrate, you know, like celebrate that they are going to
Right.
heaven or going to wherever they think they're going,
Yeah, I
or believe in, and more create it, you know, more of a celebration than not. Maybe it would reduce the stress level that we all experience when our loved ones pass. I don't know, but
Yeah.
I never looked at it that way, and I
Yeah.
think that's an interesting point.
Yes, please call the hospice doula. Like
Yes.
once I'm at this point of these things are happening to me, we could literally lay those things out, right?
I will be a hospice doula.
Yeah.
Right.
Hire her. You can take on a part-time job, I think. But having, you know, here's my wishes. Hire this person. I've already talked to her. That, to really advocate it, we plan vacations, spend that much time on your death.
Yeah.
Right?
Right.
Like, you plan a trip to wherever, and you're, even with online Google
Plan your
searches and
trip to
everything,
heaven.
plan your trip to heaven. I
You
love
know,
it. Yes.
I think that's a great idea.
It is.
You know, it's the one subject we talk so little about in this country is
Yep.
death. We avoid it at all costs.
Yep.
And it's really a shame, because the more I have experienced, the more I feel as though I'm learning about it, just discussing it with people, and tonight's podcast. You know, the more I've realized that, yeah, maybe there is a totally different view we should take to dying than we
I will
actually
tell
do in
you
this country.
Yeah.
that when I've had, you know, when I worked in hospice and had patients that were comfortable and passed when I was there holding them or whatever, it
Right.
is spiritual. It is, it's life changing to hold
Mm-hmm.
somebody when they're dying. It truly is.
It is.
It's memorable, and it is very similar to being there when a baby is born,
Yes,
as
yes.
far as you will remember that experience, just like you'll remember birth
But it
and a
also
wedding.
struck me as, like, I felt like, you know, when I feel like somebody's going towards the light, it struck me as beautiful. You know,
Mm-hmm.
it's a privilege to be there when someone is dying.
When you have a peaceful death, it is.
Yeah. Yeah.
Yeah.
Tell us a good story.
Mm.
What's a good death look like, Melissa?
I'm trying to think of a name or without saying a name.
Yeah.
But you know, a little lady she had dementia.
Okay.
And the frontal lobe
Okay.
was like all over the place. So this poor little thing who was cute as a button, who could walk around the block,
They all are. God.
would talk gibberish and word salad and wouldn't eat.
Okay.
Oh.
And he wanted to honor her wishes. He wouldn't put a tube feeding. He wouldn't give her IV fluids.
Didn't want to eat anymore.
And when she didn't want to eat, he was okay with it, and giving her a little bit of morphine for the breathing and the heart rate. Very, very important.
Yeah. Very little.
No, it doesn't take. Yeah, 0.25 is nothing. It's like a Percocet.
Yeah.
But just giving her that every 4 hours kept her so comfortable. It was beautiful. It was beautiful. She just died peacefully, and he was,
Wow.
touched and grateful, and yeah.
Wow.
Yeah.
Sounds like he had seen it before, and he kind of knew what
Yeah,
to do.
he been around the block. He knew
Okay.
what was going to happen. So
Awesome.
yeah.
Wow. Yeah, that sounds Sounds very nice.
Yeah.
I have somebody that does
To
that
have
for
like
me.
all these people just taking care of you and making you comfortable.
Yeah.
And
Yes.
that's it.
Yeah.
Yes. That's important.
Yeah. The
Yep.
last one I
Aw.
saw, he had his favorite chocolate chip cookie one night and then he didn't eat again, and we were all so glad that was his favorite last meal, and there's a lot of calories in a chocolate chip cookie. So, yeah, hopefully all of us have more understanding now. And yeah, we might hopefully look at death, talk about it better, more openly, and actually plan it.
Yeah.
And
Yes.
say, because it could happen anytime. It's not like planning a wedding. It is like, it's a lot like a birth. Look, we've got a window. And it's this 3 months.
And the older you get, the shorter it gets.
Oh, isn't that the truth?
And hey, maybe every weekend is a party until you collapse. I don't know.
Yep.
Whatever you want, but you should get what you want. And the money you save, just know when to spend it.
Right.
Podcast.
That's a whole. Yeah.
We'll talk
Yes.
about
Well,
that next time.
I told my children when it's my time, I expect nothing more than for them to go to happy hour. So
There you go.
Okay.
That's
so
gonna
how
be-
I celebrated my father's death.
right. There you
We went
go.
back to my aunt's house or my cousin's house, and drank a couple bottles of wine and told stories about some of the crazy stuff he did.
So not celebrated, but you honored him.
Honored.
In memory.
You honored him. That's
By
true.
drinking.
Yes.
But you,
Not celebrated.
Right, but yeah.
But
I don't know.
telling
I
these
think my
stories-
kids would do both.
Oh, no.
I'm just kidding.
That's terrible.
I'm just kidding.
Yeah, that's very lucky to all have very close relationships.
Yeah.
Yes.
Just make sure the one you pick is the strongest.
Right? Yes. Very true.
That's very
Oh.
true. Like the one that can
I can say nope.
Right?
not look at you as that person in their life, but take a different kind of approach and be, just like I say, being a parent, you can't be their friend, you're their parent. This
Right.
is a similar situation. You can't be their friend, and
Yeah.
you have to be their advocate and do what's hard.
Yep.
Right.
Yeah. Well, girls, this was awesome.
Yes, it was.
And I think it's the
Yes.
longest podcast
I
we've ever
know.
recorded.
I know. That's good.
Almost an hour. But we had fun tonight.
Yes,
talking
we
about death.
As I do.
I hope everyone in the audience will go have a drink or an ice cream or something. Get this conversation down. And
Thank you
this
so
was
much.
good.
Yeah, thank you, Melissa, for joining
Thank
us
you.
tonight.
Yeah.
We appreciate it.
Yeah, it's very needed.
Yes, very much so.
All right. Thank you, everybody, for joining us. And we'll see you next time on the My Status Quo podcast. This podcast was brought to you by the My Status Quo Home Catalog.